Welcome to the Cardiac Rehab and Secondary Prevention Program. In this video you'll learn how your heart works and what can happen when it's not working well. The heart is a pump made of muscle and about the size of your fist. It has a mechanical or muscle and structure system, an electrical or rhythm system, and a plumbing or blood flow to the heart muscle system. First, let's talk about the mechanical system or structure of the heart. The heart has 4 parts, called chambers. There are 2 upper chambers called an atrium, and 2 lower chambers called ventricles. When your heart is relaxed, your chambers fill with blood. When it contracts or squeezes, it pumps blood to your lungs and other important parts of your body. If your heart muscle isn't working properly, blood doesn't move through the body as well as it should. There are 4 valves in your heart: the tricuspid valve, pulmonary valve, mitral valve, and the aortic valve. If the valves aren't working properly, blood doesn't move forward through the body as it should. If the valves are narrow, it blocks the blood from passing through to your body. If the valves don't close properly, blood can flow backward in your heart. The electrical system is what makes your heart squeeze or contract. To make your heart contract properly, it needs an electrical signal. This electrical signal starts in a part of the right atrium called the sinoatrial or SA node, and it moves across the heart's upper and lower chambers. If the electrical system in your heart isn't working, your heart may not squeeze properly. Every cell in your body requires blood that is rich in oxygen to work properly. The heart's main job is to work with the lungs to provide a constant supply of blood that's rich in oxygen to the rest of your body. Every time you take a breath of air, oxygen from the air goes into your lungs and moves into the blood vessels around the lungs. From there, the oxygen-rich blood returns to the left side of the heart. And then the left ventricle pumps the oxygen-rich blood to the body. Glucose is a sugar that travels in the blood and is a basic fuel source for the body. As blood flows through your body, cells take the oxygen and sugar from the blood and combine them to release energy, which powers everything we do. After energy is released, there is less oxygen in the blood, so the blood makes its way back to the right side of the heart, and then back into the lungs, filling it with oxygen again. The cycle repeats over and over throughout the day. You might be thinking, if every cell in the body needs a constant supply of oxygen and blood sugar to function properly, how is the heart muscle itself supplied with oxygen and blood sugar? Let's take a look. Like all muscles and cells, the heart needs its own supply of oxygen-rich blood and blood sugar to function. This is where the plumbing system we talked about earlier comes in. Arteries in the heart, called the coronary arteries, are responsible for this important job and act as the heart circulation system. When these arteries become narrowed, blocked, or damaged, the heart doesn't get enough oxygen in order to function effectively, which causes coronary artery disease. Coronary artery disease is the most common type of heart disease that we see in cardiac rehab. Once a section of the artery wall is weakened or damaged, inflammation can occur, and more plaque starts to build up. This buildup of plaque and inflammation causes that area of the artery to swell and bulge, and as a result, less blood is able to pass through. When blood can't move through the artery, the cells behind the blockage are starved of the oxygen-rich blood that is needed for the heart to function at its best. We know that when cells are starved of oxygen-rich blood, they can't do their job. In this case, the heart might not pump as strongly as it's supposed to, which can lead to chest pain, also known as angina. If a heart cell is starved of oxygen long enough, it can die, causing either a heart attack or cardiac arrest, which is when the heart stops suddenly. In summary, the heart is a muscle that pumps oxygen and glucose to the rest of the body. Any changes to any of the systems, mechanical, electrical, or plumbing, can impact how the heart functions. The good news is, there are lots of things you can do to help your heart function at its best. A few examples are taking your medications as prescribed, exercising regularly, eating a heart-healthy diet, managing your stress. If you have questions about how your heart works, please speak with your cardiac rehab team member.